Florida is committing $200 million to rural healthcare, and mobile clinics are in the plan. In this video, I'm going to break down what the Rural Health Transformation Program is and how Florida's rural health providers can get money for their mobile health programs. Here's something that most providers don't realize when they start looking at this program. You don't have to convince Florida that mobile health is a good idea. They have already decided that. Florida's Rural Health Transformation Program application specifically identifies mobile health as a core strategic objective. It's not an experiment, it's not a pilot, it's a named initiative with funded outcomes attached to it. The reason is pretty straightforward. Florida's data says that a rural resident travels an average of 20 to 30 miles to reach the nearest hospital. Many counties have no reliable transportation, so the state asked one simple question. If patients can't get to care, how do we get care to them? Mobile health was the answer that they wrote into this program. That means that when a rural health provider walks into a grant conversation with a mobile application, they are not fighting the committee. They're handing them exactly what the program was designed to fund. Now, the program covers several types of mobile care, and the one with the most urgent need might not be the one you expect. Behavioral health is one of the most critical shortages in rural Florida. Their RHTP application calls behavioral health out specifically. Rural communities don't have enough providers. Those that do get help for mental health and substance use crises at a local hospital lose out on that care after they get discharged. Florida's response is to fund behavioral telehealth, telepsychiatry hubs, and care navigation programs that follow patients back into their communities. That is where a mobile counseling van changes the equation. Instead of somebody in crisis finding their way to a clinic, you bring a safe, comfortable space directly to them. A counselor, a quiet room, and a space that it does not feel intimidating, close to their home surroundings, comes directly to them. The AVAN mobile counseling vehicle is built specifically for this. Soft seating, soundproof walls, dimmable lighting. It's designed to feel like a space where people actually want to open up. It's not a treatment room, not a waiting area. For behavioral health programs, housing projects, or street outreach teams applying for funding, this is one of the most direct alignments in the entire RHTP application. But behavioral health is one piece of a much larger picture. The program also funds the type of primary care that rural communities have gone without for years. Florida's Mobile Health Initiative lists its priorities very clearly. Preventative care, diagnostic screening, prenatal services, rehabilitative care, and services in remote areas. The program ties outcomes to real targets. Improve screening rates for hypertension, diabetes, and cancer, and better maternal health indicators across rural Florida. The AVAN Mobile Health Clinic encompasses all these services. It's got a full clinic interior, custom cabinetry, an exam bed, medical storage, a sink, climate control, and bright lighting. It's like bringing the physician clinic directly to the patient. For FQHCs, rural health clinics, and public health departments already delivering these services, but struggle to reach people in outlying areas, a mobile clinic does not replace your existing program. It simply extends it. You reach the people who currently cannot get to you. The program also rewards real-time data sharing through the Florida Health Information Exchange. These vehicles can be set up to support that kind of connectivity, which ties directly into Florida's initiative for technology-enabled, data-driven rural care. And that brings us to the piece that most people have not thought through yet. Throughout the RHTP application, Florida ties its rural health strategy to telehealth. Remote patient monitoring, telespecialists, behavioral telehealth, telepsychiatry, and connected care across the board. The assumption is that technology is how the gap is closed between where the patient is and where the specialists are. Most people picture telehealth happening inside of a building, a fixed clinic, a broadband connection, and a screen on the wall. It does not have to be. Any AVAN medical unit, whether that's the mobile clinic, the outreach van, or the counseling van, they can all be equipped with satellite internet. Wherever the vehicle parks, you have secure, high-speed connection. A patient in rural Florida can have a telehealth consult without leaving their community. Your staff can share data in real time with the Florida Health Information Exchange. You can run remote monitoring and care coordination from a parking lot. The van becomes the access point. That is not a stretch of Florida's vision. It's exactly what they prescribed. Florida's award for the first year of RHTP is $209.9 million. That is the funding that is on the table right now. The program runs through 2031, so future funding cycles are coming. But providers who are ready and positioned for year one have a major advantage. Florida has 15 initiatives. They've mostly been bundled into 2 RFAs, but there is also 4 standalone opportunities. All of their RFAs have language that surrounds mobile healthcare, so they're definitely worth looking into. The one that focuses strongest on mobile units is Bundle 1, Preventative Care and Care at Home. All RFAs opened on April 21st with applications due on June 10th. That is a fast turnaround. Florida wants the money out the door and helping rural communities as fast as possible. So don't wait to get your applications and the documents together. At AVAN Mobility, we build the vehicles that make these programs possible. If you're preparing an application and want to understand what a mobile health program could look like for your organization, please reach out. The funding is there, the need is real. The question is whether your community will get a van on the road. If you have any questions, drop it in the comments below. We're always here to help.